Myopia treatment is a marathon, not a sprint. It doesn't end with just a prescription. Patients need to return regularly to the clinic so we can track their myopia progression and assess the effectiveness of the treatment. Hi, I'm Dr. Erin Tomiyama, and I'll be discussing the importance of follow-up care in myopia management. We'll cover follow-up plans and procedures, as well as the best practices for co-managing cases. It's important to follow up with patients for three reasons. One being compliance. We want to make sure that once we use some sort of intervention that their patient is actually being, adhering to the treatment that we're prescribing. It's hard to, look at progression measurements and then know whether or not that's because the patient is actually progressing at a fast rate or it's because the patient is not actually using the treatment. Another one is patient satisfaction. We want to make sure that with the treatment modality that we're prescribing, that the patient is actually used that intervention without affecting their quality of life and they're actually able to use their vision as well. The last one is monitoring for progression. So once we use some sort of myopia intervention, it's important to have kind of a shorter follow-up window than you would with a child that is just coming in for routine eye care. When we're developing some sort of treatment plan, we want to consider various factors. The first one being age. We know that children tend to progress the most, probably during the ages of 7 to 12. So when we have a child that kind of falls within that age range, particularly on the younger end, we do want to monitor a little bit more frequently in order to make sure that we're, catching myopia or catching progression as quickly as possible. In terms of severity of myopia, follow-up schedule is not necessarily different for low myopia versus high myopia. In terms of somebody who is pre-myopic or somebody that has a lot of risk factors, that person you would probably want to follow up, more frequently so you can really catch it as soon as it begins. In terms of progression rate, we know that previous progression doesn't necessarily dictate future progression. I do think clinically that if I see somebody that takes a really large jump over a period of maybe 6 months, I'm probably more inclined to have them back for like a 3-month follow-up just to check again. Also, if you're treating somebody that's progressed faster or it has a higher level of myopia, you're probably going to want to follow them a little bit more closely. Effective communication to both the patient and the parent is really important in regards to follow-up visits. What we're doing is really trying to look at the progression of myopia, and there's no way to monitor for progression if we're not following up with the patient. So it's important to reiterate why we're doing myopia management and why it's important and why the patient needs to come back for their visits. We want to make sure that the patient is being compliant with the treatment, the progression is not exceeding a level that we need to, change our treatment plan. The gold standard in assessing progression is really axial length measurements. So that's the #1 tool that we're going to look at. We can also look at cycloplegic refractive error. We like to look at objective measurements, so that would be something like an autorefraction. And in order to determine if this treatment is really being effective, we have to compare to normative values that we understand. So using things like growth charts or growth tables can be really helpful. It's important that you're comparing a 7-year-old Asian child to the data that you would assume a 7-year-old Asian child is progressing at, because that rate is going to look very different than a Caucasian 12-year-old or 16-year-old child. When we're talking about diagnosing myopia or those early follow-up visits where you're trying to explain what's happening, it's also really helpful to have pictures and eye models to really explain what's happening to the eye and what we're doing by using these interventions. Two different different situations come to mind in terms of co-managing patients with other healthcare professionals. I think one would be patients that have binocular vision issues. A lot of times these binocular vision issues need to be addressed before we implement myopia management strategies, whether that be a referral to another pediatric optometrist that does vision therapy, or a pediatric ophthalmologist for some sort of surgery if the patient has strabismus or something like that. Another that comes to mind would be somebody that has retinal complications, so something like a retinal tear or a hole, referring them to retinal specialists to make sure that they don't need any sort of prophylactic treatment or any other intervention. One patient that I had came to us actually uncorrected. The patient preferred not to wear any sort of correction at all. And our initial testing does look at binocular vision issues, and he had lower ranges. So we implemented a myopia management strategy. We actually put him in orthokeratology lenses, and basically we're forcing him to be corrected. So when we did this, he actually started getting diplopia. So he was seeing double. Further investigation, it was clear that it was because he just didn't have great ranges to compensate for being corrected all the time now. So this prompted us to refer to our colleagues in vision therapy. They were able to work with this patient to be able to improve his ranges so that he was able to maintain clear and single image. Co-management can sometimes be challenging. I think it's really important that you find an optometrist or an ophthalmologist, somebody that you can develop a really good relationship with, and there are open lines of communication. You also want to find somebody that kind of has a similar treatment and management style to you, and you guys agree on what the best plan of action would be for your patient.